it's just like I remember before I got my surgery, like I knew things were getting bad when I would like get up in the morning and go to get out of bed, and literally like my hip was just like stiff as a rock, and like I was like, why should I be feeling like this like right now? Like it didn't seem fair and anything like that. So
Welcome to Advocate for Sickle Cell. Today we're going to be talking to Mikhaili, and Mikhaili is the son of very good friends of mine, pictured here with James, Derek and Shantae Robertson. They are the founders of the Maryland Sickle Cell Disease Association of America, and they have been very good friends of mine for many years. And they have afforded me the opportunity to really be able to advocate more and more and the sickle cell community. They have been very supportive of my advocacy and just opened me up to a lot of different opportunities. And so I talked to their son, Mikhaili. He was diagnosed with sickle cell beta thalassemia, and he is going to talk about a procedure he got done due to a vascular necrosis in his hip, which is the same thing that I suffered from back when I was a teenager, and I posted a whole video about a hip replacement that I received. But Mikhaili is going to be talking about a procedure that he got done, which was not a hip replacement. He was gracious enough to share his story in hopes that it will help someone else. So if you have any comments or questions for Mikhaili, please post them in the comments below.
So like around the beginning of summer last year, I played baseball for my school at Hood, and like around the end of the season, like I started to kind of feel like a nagging kind of tightness pain in my right hip, and I actually thought I had 2 years prior I had like a fracture in my hip, like an avulsion fracture, which had like caused me to miss part of that season. But it actually
Fracture
from actually playing baseball.
Okay.
Like I slid into a base funny and it kind of just popped. But like I thought that's what it was, just kind of hopping back up again. But then like it kept persisting and persisting, and then like I took some time away from baseball, and then like again I really thought it was just sports related. I didn't really think it was like anything more serious than that. But like throughout the summer, like I kept playing baseball, but like after the game, like it would just feel like super tired, super like achy, and like just not good, like always tight, always just like straining and everything. So then finally at the end of the summer, like my family and I went on vacation, and like we were walking around, of course, whole vacation, and I was complaining about it then if it's just hurting. So we said, all right, let's go get an MRI, let's get it checked out. And then when we referred to another doctor, he showed us that like that's what I had was avascular necrosis, and that was really difficult for me because I knew at that point I was just about to start my sophomore year of college, so this was probably the week before I went back and before I was about to move back into school and everything, and it was just really frustrating because I didn't really know what to do. They said that, well, of course, my first question was for baseball. Like I didn't really think other than that, which down the line it affected a lot more than just playing baseball. But at the time I was just like, when am I going to be able to start playing baseball again? He said it really could be anywhere from like 6 months to like a year, and that's what really threw me off a lot. And it was just really difficult. I didn't really know what to do next with it, and then there was like a couple different options on the table. There was either do the core decompression, which was, I guess was injections into the hip to kind of release some of that pressure in it, or just to kind of wait it out and maybe do physical therapy and see if it were to kind of resolve on its own in some way, that I didn't have to do any kind of intervention with it. And that was really difficult because I really didn't want to do any surgical thing, because I knew, like, in my mind, I still kind of wanted to get back to playing baseball. Like, I kind of, like, in my mind, I was like, okay, probably not going to... We have a fall season for baseball, so I was like, I'm probably not going to get to play in the fall, but maybe with this, I can play in the spring if something works out. But, like...
So is it keeping you from, like, running?
It was keeping me... I was on crutches, actually. So, yeah, so that was another big thing. Like, once they saw that I had, like, the AVN in my hip, they immediately had me get on crutches, and then... Because they said the less stress I can put on my hip, and like the less chance it was of like anything progressing.
When you first started feeling the pain, like how long from that point to crutches, like how long was that?
So really that whole summer when I was kind of feeling that like ache, and it was also only when I was playing baseball. Like I would take like a day off and I'd start to feel fine again. But once like you know, I got on the crutches, I still felt like I didn't really need them. I could just like walk. It was more of just like a preventative thing that like it didn't get any kind of, it didn't get worse.
Yeah.
But I still felt like I didn't really need them. Like, and I'm kind of guilty. Like I would like sometimes if like I was like kind of frustrated, I would just ditch them and just like walk without them. But then but you know, as the months passed by, like I remember I got the diagnosis in like the end of August, and I went back in for another appointment in like the beginning of October. So like we had about a month period to see if anything was either going to resolve or if we would have to take like further steps.
Okay.
And then, so, you know, I did PT throughout that month, stayed on the crutches, and nothing really got better. Actually, in fact, it started to progress. And I believe when I first saw it on the MRI, I think they said it was like in stage 1, so like the very early stages of it, which was good, like, which they caught it at an early time. But the bad thing was once we went in again, it was probably about like stage 3. So at a point where it was kind of...
So that was like only a month and a half.
Right, it was only about a month and a half, and that's just the kind of way it went, which was frustrating because at that point, they were like, you know, it's getting to be the point where it might be a little too late to do anything like a core decompression. That would actually, you know, like...
Wow, that was fast.
It was very fast.
So did you have any pain crisis within that time?
I actually didn't. I hadn't had any really significant pain crises since about like a year before that.
Okay.
And
so and you have beta thalassemia?
Right, sickle beta thalassemia.
Okay.
Yep.
And do you take like hydroxyurea?
I do.
Okay.
I've been taking that since I was like 11, so I've been taking it for a long time now. But yeah, I didn't have any kind of sickle cell symptoms or anything like that in between then. But when we went back in October, they basically said it. You know, at this point, the time that the core decompression would have worked was probably a little bit before now, so it might not be as effective if I did it now. Yeah. And then, of course, the next step that everybody thinks with the AVN is a hip replacement, which I just like having like I've always been like a really active person. Like I've always played sports, and like I said, I play baseball for my school team, and I knew if I got a hip replacement, that's just really all that is going to go out the window, and like my level of activity is just going to have to go down a lot, which really just that kind of hit me pretty hard, and I didn't really want to do any of that. So, you know, it took like the next about probably throughout the rest of October to kind of think about with my family what we wanted to do, and kind of research different options, and just really trying to find anything to see what we could do to avoid that. And like fortunately, we were able to come across a doctor in Minnesota at the Mayo Clinic named Rafael Sierra. And we were able to get in contact with him because we found out there was like a certain surgery where you could go in and like dislocate the hip and go into like the area of the bone that's being affected by the AVN, and basically take that area of the bone out and replace it with like a donor bone, so like healthy bone, and then put it back in. So,
like a bone marrow transplant?
Not as deep as a bone marrow transplant, but like basically taking out the area of the bone that's affected by the necrosis, and then replacing it with healthy bone, like so somebody else's bone. Yeah.
So you had to, you had to get like a certain match or something?
Actually, yeah. So when we were told about this and thinking that that's something we had to do, we had to actually get on like it wasn't like a list like a kidney transplant or heart transplant list, but it was like we had to make sure that like the bone that was going to be like transplanted into me was able to be like a match with my blood type, and also like so it wouldn't be rejected, and also that like I guess that bone was healthy too. So it was a whole process. It wasn't just like they could like pick it out of like a shelf. They had to like actually make sure that bone would work with me, like that it matched up with my blood type and like my system. So
wow, I've never heard that before.
Neither had I. Like that's why like when we heard it, I was kind of at the point where I was just like, I don't care. I kind of just I don't want to do a hip replacement. And the way that Dr. Sierra had described it to us was just like, you know, like he couldn't guarantee us that it was gonna work, but like honestly, at the age that I'm at, like 19, I was 19 at the time. I'm 20 now, but I was 19 at the time, and having a hip replacement at that age, it's pretty much guaranteed that you're going to need one a lot sooner than if you were 50 or 60 years old. So like kind of hands up at that point. I was just like, let's try it. And so I ended up having the surgery in December, and December 12th. And from then on, that was like, they actually said it was a really big success, the surgery.
Oh,
So
really?
like they said it went as well as it could have gone.
Cool.
And yeah, the doctor, I ended up flying over to Minnesota, and I stayed there for a week. I stayed in the hospital for like 3 or 4 days, stayed in the hotel for another 3 or 4 days, but they said it went as good as it could have gone. And the whole team of doctors there was just awesome. And actually, another important thing before that, I had a blood transfusion at Hopkins.
Okay.
I had a blood
Just
transfusion.
one?
Right, just one at Hopkins before I went. This was like a couple days before I went.
Yeah.
Had my surgery, and then when I came back, I had another transfusion a month after my first one.
Oh, okay.
So the whole surgery itself took about, I think it ended up being like an hour and a half, 2 hour long surgery.
Wow,
So
that's not long
it
at all.
it actually wasn't that long. It was a pretty invasive surgery. But and like I remember seeing the scar, and it was probably about a good like 7 or 8 inch scar on the side of my leg.
Okay.
Then the next day I woke up, and it was definitely like, I remember not even trying to move my leg. I think I like moved over to get something in my bed, and it was, yeah, it was, it was a really sharp pain that just,
I remember that. Why would more people not go that route versus the hip replacement route? Is it that they just don't know about it, or is this like a new technology that has come out recently? Or?
Push. I don't think a whole lot of people, for one, really know about it, and like also, because I had no idea. This wasn't even something, because like when you search up AVN treatments, like the biggest things are the core decompression and hip replacement.
Right.
And with this one, this is so outside of the box that like not really a whole lot. I didn't know about it. I mean, a lot of doctors who we had asked about it didn't really know much about it, but they said like in theory, yeah, it would probably work. But even like, and I don't even think it's like some like super crazy technology or anything like that. I think it's just like something that was outside of the box, and I really just personally wanted to avoid hip replacement. And I think you know, for other people, hip replacement is a good option for AVN because it's kind of like a fresh start for your hip. But like,
well, yeah.
No, sure.
I mean, yeah, no, that's true.
Yeah.
That could be. As far as like years from now, is it something that is just going to last you, or will you have to get it done again?
In best case scenario, it's supposed to delay like getting a hip replacement for as long as possible. Hopefully.
And is that your goal? Is to delay it, or is your goal to not? So is it that you don't want to get one? Well, of course you don't want to get one at all. But have you kind of like come to terms with like, okay, I'll have to get one at some point, or are you thinking like this should be it and you don't have to ever get one?
My hope is to never have to get one. But you know, realistically, I consider it, and like our whole team of doctors consider it a win if I'm able to wait 15, 20 years to get a hip replacement. Because for me, like right now, being in my early 20s, I don't really want to have to, you know, like sacrifice getting a hip replacement, because that probably, you know, would change a lot of your lifestyle.
How do you feel now?
Yeah, like I'm feeling great actually. So it's like yesterday I just ran a 5K.
Oh,
and like,
cool.
so it's like 11 months out of surgery, doing that. It just feels, I finished up my fall season with my baseball team. And, you know, there's some days are better than others with my hips. So like some days, like I'll wake up and it's just dragging kind of, and like it's and, like the point I'm at now, it's just really, you have to sit back and take a look, because it's kind of crazy. Because like I remember 4 months ago, just being where I'm at, like I wasn't able to jog. I was just getting my stride back with walking, and it's just the whole process of just like, I remember when I got off of crutches, like I could barely take a step off my foot without like just keeping my balance, and then I went from that to limping, and then it took me a long time just to get not limping and get my kind of walking gait back, and that honestly took the longest. Is just it's bigger than even just playing a sport or running. It's just like day to day, like, you know, being able to like go out with my family and walk around without one having crutches or being aching in my hip, and just the day to day things like getting out of bed and not feeling stiff and sitting down in a chair and not hurting. It's
Stuff
just,
that young people should not have to do.
Exactly.
Or anybody really, but especially when you're young.
Yeah, it's like it's stuff you really don't even think about.
Yeah.
It's just,